The most important point that listeners should take away from the question that you asked is to start thinking much more holistically in terms of how they approach problems and specific problems, but really overall the patient. Okay, so first of all, I would argue that patients that have only lower GI symptoms or only upper GI symptoms are different than patients that have both. For example, I think that patients that have both, if they have an underlying motility disorder, for example, it's more likely to be a pan-motility disorder where you have at least subtle abnormalities affecting multiple locations in the GI tract, and or I think that those symptoms are oftentimes centrally driven. In other words, if you think about why would somebody get pain all over or symptoms that involve the joints, the eyes, the gastrointestinal tract, I believe that patients that have multiple overlapping pain disorders are largely centrally driven. So they have abnormalities in either sensing, processing, or controlling painful types of sensations. And so, again, if you think about that, taking a more holistic approach, thinking carefully about how diet, how behavioral therapies may fit into the treatment paradigm, as opposed to just jumping right to medications and focusing only on medications, is clearly how the treatment of not just GI disease, but all disease is going to progress. There are many groups, including our own, that are working on novel diagnostics. So, for example, trying to identify fingerprints, utilizing different types of biomarker strategies that helps you to understand the underlying pathophysiology of a patient's symptoms, and in that way directs you towards a more specific therapy as opposed to this sort of empiric one-size-fits-all approach that I've actually endorsed at this meeting. Let me be clear about this. The only reason I endorse that right now is because we don't have anything better. The future hopefully will include better diagnostic tests which help us to subgroup patients with the same kinds of symptoms and stratify them based upon the most likely underlying abnormality, and in that way move us more towards a specific type of therapy. Right now, I think very simple things, again, like if symptoms are meal related, I would argue that diet should be a really important part of the management strategy, upper or lower symptoms, by the way. If a person has significant stress or has developed a conditioned response as a consequence of their symptoms, in other words, because they have symptoms in association with some behavior or activity, that it's very likely that over time individuals have actually learned to become fearful. In association, well, when I do this, I'm likely to get that. And that conditioned response can be very, very effectively broken with behavioral therapy, with psychological therapies, as opposed to just giving medications.